Coker, Executive Director of ASHK Society Southern California. I'd like to welcome you to our program, COVID-19 Vaccine Rollout. We're very proud this evening to be co-partnering on this program with our colleagues from Hong Kong, our ASHK Society Hong Kong Center. This evening, Ronnie Chan, Chairman of ASHK Society Hong Kong and former Global Trustee Co-Chair, will be giving a few introductory remarks. So without further ado, I will turn it over to Ronnie Chan. Thank you.
Welcome. I'm Ronnie Chan. I'm the chairman of the ASHK Society Hong Kong Center. This is the 28th episode that the ASHK Society Hong Kong Center have brought to the world on this topic of the coronavirus. We started 13 months ago. I'm very happy that we are collaborating this time with the ASHK Society Southern California Center, a center with which I have worked for the last 25 years very closely. I understand that you only recently had a program with Dean Rochelle William of the Harvard Chan School of Public Health, and we're delighted that we can work together on this topic. Well, I can think of 3 reasons why this program is so important. Number 1, the topic is serious and it's very timely. Number 2, we have 3 superb speakers. Dr. Sophia Chan is from Hong Kong, and she is the Hong Kong government's Secretary for Food and Health. We also have Dr. James Curran, the Dean of the Rollins School of Public Health at Emory University. Many of you may be wondering, Ronnie, do you have a relationship with Emory? Well, 2014, when I visited the School of Public Health at Emory University, it was Dr. Curran that received me. I understand that Dr. Curran may still be associated with the Morningside Center for Innovative and Affordable Medicine at the Medical School at Emory University, a center with which my family is associated. Last but not least, we have Dr. Ashish K. For a long time, for something like 16, 17 years, he has been a distinguished professor at the Harvard Chan School, and surely one of the world leaders in preparedness and response on pandemics. So the 3 of you, together with your fellow professionals in public health, are perhaps today's most important people in the world. Finally, I can think of one other reason why this program is so important, because all 3 of our speakers are graduates of the Harvard Chan School of Public Health. So ladies and gentlemen, sit up, learn, and enjoy.
I want to thank Dr. Sophia Chan, Secretary of Food and Health here in Hong Kong, for joining us for this discussion about the vaccine rollout. And specifically, I want to ask Dr. Chan about Hong Kong, but also maybe contrast what is happening around Asia, maybe kind of from her professional lens, compare and contrast what's going on around Asia as well as the world. So Dr. Chan, you are probably one of the hardest women, working women in Hong Kong today. And I want to thank you on behalf of all of us. This has been a tough year. Since in Hong Kong, we kind of got it earlier than anybody else. We started hearing about it in January. So your life, all of our life have changed now for forever. But can you tell us more about some of the latest development with the vaccine rollout program in Hong Kong, which began in February?
Thank you, Alice. I think it's been a challenging year for all of us, but I continue to be proud to be part of this fight, with the virus. Of course, vaccination is something that we have always been hoping for, and now we have it in Hong Kong. Since I think the 26th of February, we have authorized, 2 types of vaccine for use, for emergency use in Hong Kong. So we have started the vaccination program. And ever since the past few weeks, we have been expanding the priority groups. Initially, we started with a few groups, including, of course, healthcare professionals and people working in the elderly homes and people who are in critical services and so on. But most recently, we have lower the age limit starting from 30 to 59. And of course, those who are above, 59 are also included. So now the eligible population is about 5.5 million. That is about 80% of people who are eligible above 16 of age, because the 2 types of vaccine, one of them can only use for people who are above 18 and the other one is above 16. So far it has been quite smooth. We have a total of 29 what we call community vaccination centers. Some are doing the Sinovac vaccine. The other one is community vaccine, or we call BioNTech vaccine. So we also have for Sinovac, because the storage and also delivery is less challenging. So therefore, it can be done in the private GP's clinic. We have over 1,400 GPs with about 2,000 sites that are also providing Sinovac, and also 18 general outpatient clinics in the public system. For BioNTech, of course, in the there are a total of, I think, 7 plus 12, a total of 19.
Dr. Sophia Chan, Secretary of Food and Health here in Hong Kong, for joining us for this discussion.
I think the latest figures, we have about 250,000 people in Hong Kong already been vaccinated, and of course we hope the numbers will go on. But that is only the first dose. We need 2 doses. So I think so far we have been trying to promote the confidence of people in vaccination, because it is voluntary, and we have a choice for people as to which vaccine they're going to get in different centers. But I think it is important for us to have public and also transparent information about each vaccine, so that people understand what technical platform they are in, and what are some of the possible complications or side effects, and what are some of the contraindications that, in what condition that people shouldn't be taking the vaccine. So all these are transparent, and we have a dedicated website. And of course, the most important is because the vaccine development is still pretty new, because it has started, it's R&D, for about a year. And so therefore, the time frame of development and research is really, really short if you compare with other developed vaccines. So therefore, we have developed a mechanism under the Department of Health to really do surveillance of all the vaccine-related adverse events, so that we are aware of the situation, and that we have a notification system by the healthcare professionals. So all those are in place, but it is still important to get people's confidence, because with some of the cases that they have got vaccinated, but because they also might have other conditions, and it happened that they died, or in cases where they have gone into the intensive care unit, people started to worry. But because we have a clinical events committee look at whether there is any causality. So the causality assessment is most important. And so far, our experts have told us publicly that all these adverse events, so-called, do not have any relationship or causality with the vaccination.
I think you talk about the causality. My concern, I guess one of the questions I want to ask you, what are your major concerns? Like you said, everything has been rolled out, everything has happened so fast, and the development has been really, in record time, less than 11 months. And when we were talking to Professor Cowling, I remember our first program, we thought it was going to be 2 or 3 years to get a vaccine out, and in the world, in Hong Kong, really less than a year. So what are your major concern as, our Secretary of Food and Health here in Hong Kong with a vaccine rollout?
I think the most important thing is really for more people to get vaccinated in the shortest time, because with the prevention and control of the epidemic, I mean, we have been, doing it for a year now. We have different waves, and we have been successfully curbing, some of the waves. We are in the tail end of the fourth wave now, but then I think vaccination is our hope, because with more people getting vaccinated, the shorter time we can achieve a larger proportion of people getting vaccinated. That means, one, that they are protected individually. Two, I think, their friends, their family are also protected. And if we have got enough people, we can achieve a herd immunity so that the entire society is vaccinated. And with that not only can we control the epidemic with less confirmed cases, and that people's health and life are protected, but also I think we are about to hopefully resume, many of our daily lives, and also our economy, as well as, our travel, because many people are really hoping to travel, not only for pleasure, but also, I think, for business. In order for us to revive our economy, I think, some travel, be it across the border to the mainland or international travel, is important. So I think the more people are getting vaccinated in a shorter time, the faster we'll be able to get our herd immunity, the better we are in a position to discuss with, other places for these vaccination passports or some negotiation.
I think you're so right about the travel. I think people, people forget that Hong Kong is a small place. We're a global city, and we're proud of that. But for 7.5 million place, we're a global city, and we're proud of that. But for 7.5 million people, it's really unheard of that in this last year or so, we cannot even go across the border without quarantine, and also, or even Macau.
Yeah.
And we realize how small Hong Kong is, and the importance of trade to Hong Kong. But one of the things I want to also kind of stress is how well Hong Kong has managed the COVID-19 pandemic. Over 11,000 cases, 203 deaths in a city of 7.5 million. And I'm contrasting this with Israel, which is slightly more. They're almost 9 million people, and 824,000 cases, over 6,000 deaths. So Hong Kong has really managed in terms of, managing the crisis, the pandemic really well. But right now, I guess with a vaccine, it is really about getting us traveling, but it's kind of back to normal a little bit. Whatever normal is, we're going to have a new normal for sure. So I think that is something that Hong Kong is working on. And one of the things that Hong Kong, what I find very interesting is, having just registered myself, how easy everything has been, the government, in terms of also getting the tests, right now, Asia Society Hong Kong, in order to be open to the public, we qualify under a scheme. So every 2 weeks, all of our staff are getting tested, and my negative result came back last Friday. So for us right now, the government has been very efficient, and I knew it would be very efficient in rolling out the vaccine, because again, very easy. It took me less than 5 minutes to register, and they already have my second dose scheduled. And I'm looking forward to all the friends who have taken it. The process has been very, very seamless. I guess the question is about trust. I think that's the Hong Kong issue. I mean, it's not just Hong Kong. Almost every nation, there is a lot of hesitancy on the part of the public, because, like you said, some of the technology, especially the mRNA one, the Pfizer BioNTech one, it is a new technology. So how do you address that? Even informally, I've asked friends and informal survey, 40% of people said they are not going to take it, and 60% will eventually take it. So how do you address that trust factor?
I think, trust is indeed, I agree, is a very important issue, and somehow I think in the past years, before the epidemic, because we have this social unrest. And so the trust on the government to a certain extent has been quite fragile. But we are trying to gain the trust. But on this health issue, on this public health issue, I think, first of all, people should trust science. Second, I think they should trust the experts. For the vaccine that we have authorized for emergency use in Hong Kong, we have an independent expert panel to look at all the data supplied by the vaccine manufacturer. That is the clinical trials data, phase 1, phase 2, and phase 3. And not only that, we're also requesting them to supply data to us even after we have authorized them. That is, after they have gone post-market data, our experts will look at it. So all the vaccines that we have now authorized for emergency use are safe, efficacious, and also of the required quality as recommended to the government by this panel of experts. So I think and also, with these vaccines, the benefits actually outweigh the risks that we are exposed, in this epidemic. Not only in Hong Kong, but as you have already said, we're an international city. So we are also subject to the pandemic, globally as well. Although we are already having a very stringent border control measures, because we want to make sure, all these new variants, cannot, go into the community. Even if they happen to come into Hong Kong, because we are an international city, but we have different safeguards. For example, the testing at the airport, the quarantine for 21 days in the designated hotel and designated transport, and all these closed loop quarantining that we are trying to safeguard. So it is important that I think within the community that we get these vaccines so that our life, our social distancing measures that I think, some people are suffering, can get back to normal.
I think on that note you're right about, it's better to have the vaccine than not. The Israel numbers, I guess in over 50% of the population, about 50% of the population have been inoculated with a second dose. And the preliminary results from that is 98.9% effective in preventing death after second dose has been administered. Mm-hmm. So I found that number very, very encouraging. So that is something that I think you're right about the science, getting the information out, it was going to be a priority. But you touch upon the 21-day quarantining, and that, when I was telling friends I was going to be talking to you, that has been the number one question. So one of the question has been, with a vaccine, and many of people are going to take it. So I think the comment has been there's been a lot of stick. And is there enough carrot? For example, if you get vaccinated, when you travel, instead of 21 days, maybe 14 days or quarantining at home. Is that something? And yesterday, I think the chief executive also mentioned that in his address to LCHO about possibility of some of the changes. I know you probably can't tell us to, but I would just like to ask you about the 21-day quarantining. Will there be incentive for people, as an incentive when people are vaccinated, that they won't have to go through 21 days of quarantining?
Right. First of all, the 21-day quarantine was kind of like a new measure that we have instituted for about 2 months, and that was really because of the new variant that we have discovered. Not we have discovered, but there are these new variants from the UK, from Brazil, and South Africa, and so on. And so we really cannot afford to have these new variants. First of all, coming into the community and spreading. Secondly, I think we have also tracked all our data. For people who came in, actually, in our day 19 test, there are about 10% of people who get confirmed, positive, even with the day 19. So we at this stage, we're bound to have to keep the 21-day quarantine. But you are right about vaccination. What happened after vaccination? Can it be relaxed, or can it be some incentive? Have some incentive for people? I'm sure with more people getting vaccination, this must be the direction. I mean, we must be able, hopefully, with our experts, with more data, to relax, for example, the quarantine. the testing frequency, for example, and even, people are starting to talk about vaccination passports, that is, traveling or further bubbles. So I think this must be the direction. Right now, I think, first of all, we are looking towards the World Health Organization in terms of any new information. Secondly, I think it's also important globally because there are so many people vaccinating and there are all these information or data, that the protection and also the infectivity and all these outcome measures of after vaccination, of post-vaccination, that I'm sure many countries are measuring. Antibody, for example. So I think all these would give us more confidence in trying to work out a package or algorithm as to how and when we would be able to do all those different relaxation incentives and so on. So we are actually looking into it, and we are also consulting our experts.
But I guess the question I have now is really about Asia. What is your assessment, or from your perspective, how Asia, in terms of is handling the vaccine rollout? And I guess specifically, maybe even example. I know Singapore and Hong Kong are ahead of the curve.
Yeah.
And and China, as I said, they're going to they have big plans, but they're being kind of realistic because their numbers are so low, almost non-existent in terms of COVID numbers. So how about the other parts of Asia that you think are in terms of what they're planning for the vaccine rollout?
Well, as far as I understand, for example, some of the nearby countries, Singapore, Japan, and also Korea, they have already started vaccinated. And there are, of course, other countries in Asia that I'm sure are preparing, to do that, because we know that with more vaccine coming out, which we see actually different platforms and also different brands are coming out. So I think the availability of vaccine under COVAX, under the World Health Organization, is trying to have this platform to distribute vaccine to different countries. We have also joined, but we are lucky because we are having a two-pronged approach. One is we have joined COVAX, but at the same time we are also negotiating with the different vaccine manufacturers, and we are lucky now that we have authorized two types of vaccine. Of course, I think we do hope that more countries, be it in Asia or globally, will be getting vaccines so that, the entire world can get out of this pandemic, as soon as possible. Hong Kong cannot be alone because we are a global city. We will ultimately be affected if the rest of the world is not improving in its pandemic situation. So we do hope the entire world can be, going towards the direction of, getting vaccinated, and that we all would fight the virus together.
Thank you, Dr. Chan, for your generous time this morning. I'm really grateful for you spending the time with us and answering the questions that we posed to you. And I look forward to welcoming you back, maybe when it's under less strains right now. But thank you for all you do, and thank you on behalf of Hong Kong and behalf of Asia Society Hong Kong for your dedication and hard work. It's been a tough year, but I think right now we can see, I truly can see the light at the end of the tunnel, because with the vaccine, rollout, and so far so good. Everybody has been, the numbers look good. I understand 8-fold in terms of the people who have registered because of the recent announcement of lowering the age to 30. So I'm really hopeful that those people who are interested in getting the vaccine will do that. So again, thank you so much for your dedication and hard work.
Thank you, Alice, and thank you, Asia Society, for providing this opportunity. And thank you, Ronnie.
Thanks to Alice Mong, Asia Society Hong Kong Center Director, and Dr. Chan for that very insightful and informative discussion about the vaccine rollout in Hong Kong and in Asia. Now we'll be turning to the view from the United States. And leading that discussion will be our own very Jonathan Karp. Jonathan is a dear friend and colleague, a former executive director of Asia Society Southern California, as well as a former journalist with the Wall Street Journal and NPR. So without further ado, I'll turn it over to Jonathan.
Thank you very much, Charlie, and welcome to our audience all over the country and Asia as well. I think Europe and Latin America too, if I'm not mistaken. It was great. Professor Chan's opening interview was a great setup for our conversation. We have two incredible experts, Dr. James Curran and Dr. Ashish Jha. They are the deans of their respective public health schools at Emory for Dr. Curran and Brown for Dr. Jha. And they also have been leaders in research on other viruses. Dr. Curran was an early leader at the CDC on HIV/AIDS research, and Dr. Jha was deep into the Ebola outbreak. So this is not their first epidemic/pandemic. I'd like to start our conversation with discussing the U.S. and then segue to the global outlook, where we can play off of Professor Chan. But as of today in the U.S., there have been nearly 116 vaccinations, shots. 22% of Americans have had at least one shot. 12% have been fully vaccinated. 2/3 of the population over 65 years old have had at least one shot, and nearly 40% are fully vaccinated. So there seems to be an acceleration and progress, as by and large, the overall case rates are coming down too. So Dr. Jha, I'd like to start with you. In response recently to a challenge on Twitter to write a happy story in 4 words, you submitted, quote, "This pandemic ends soon." Could you elaborate on why you're, bullish, and to what degree do the COVID vaccines factor into your optimism?
Yeah, so first of all, thank you for having me on. It is always a pleasure and an honor to come and speak at the Asia Society. I've had the opportunity to do it both in Hong Kong and in Mumbai, and it's just an honor to do this. So thank you, Asia Society, for inviting me. Now, let me talk about that tweet of mine from a few days ago. And this pandemic will end. All pandemics end. This pandemic will end. And when I say soon, sort of begs the question, how soon? I think in America, life will get meaningfully better by this summer. And so for the United States, we are heading towards a very high level of vaccination as early as May or June, and I expect there to be a relatively normal summer here. That's not the case for the rest of the world, which I know we will get to. So if your question is what brings us out of this pandemic, it is absolutely the vaccines. These vaccines that have been developed across the board are pretty terrific, and they will end up being our ticket out of this pandemic.
Great. Well, thank you. And actually, I meant to note when I introduced you that you've already sustained a one grilling today at the House Foreign Affairs Committee. So Dr. Jha has had a very busy day. He testified on the global situation at the House Foreign Affairs Committee. Dr. Curran, do you share Dr. Jha's optimism? And given your long experience at the CDC and how you understand the importance of government leadership in public health crises, how would you rate the new administration?
Well, I agree with Dr. Jha. As a matter of fact, I'd like to borrow his tweet. I think it's terrific. Optimism is not only warranted, but it's necessary. This has been the public health crisis of the century. There's been nothing like this in the last 100 years, and it's much worse than any of us thought it would ever be. On the other hand, the scientific progress is much better than any of us could have predicted. Who would have thought in this short period of time we'd have all of these vaccines that are effective and safe and available already? Good public policy is based upon the best information available, a lot of transparency, and action. You can't wait till all the uncertainties are done to act. And as a matter of fact, the vaccines, as we know it now, are the best way for us to return to anything like normal. Now, the important thing, of course, is that government is almost always responsible for the health of the people living within the boundaries of their country. And it's extremely important to have government leadership. government leadership in messaging, government leadership in transparency, providing information, government leadership in providing technology and resources, government leadership in balancing the economic issues with the public health issues. But it should all be based upon transparency, not and accurate information, not diminishing one or the other. So government has a huge role to play. And I think in the countries in the smaller areas that have been successful, the trust in government, like in Israel, for example, has led to great success, along with the, providing materials needed.
Right. Thank you. And obviously, one of the key messages that the United States government has to get out right now is get vaccinated. Took a little straw poll of the attendees at today's program on where they stand, and over half have already started or completed the vaccine. About 15% have appointments. 32% are waiting for appointments, and less than 2% do not plan to get vaccinated. Dr. Jha, I think that's lower than what nationwide polls show. How concerned are you about this hesitancy, and how do we overcome it?
Yeah, so if America looked like the audience of the Asian Society, we would be in very good shape. Unfortunately, that is not where America is right now. So there are different polls and different surveys, but basically it's somewhere between 25 and 33%, between 1 out of 4 and 1 out of every 3 Americans says that they don't have any plans of getting vaccinated. That's a problem. It's a problem. If we actually end up only vaccinating 65% of our population, that is nowhere near where we need to be to really have the level of protection, population immunity, herd immunity, as people often talk about, to really keep this virus suppressed. We probably need to be in the 80s, maybe even into the 90s. It would certainly help, but at 60s, we're not going to get there. And there are a variety of factors. I think I am of the opinion that some of that resistance will melt away. There's still some concerns that people have that these vaccines were developed very quickly. Are they really as safe as we think they are? And I think as they watch millions of their fellow Americans getting vaccinated and doing well, I think some of that resistance will melt. But I also think there's a sizable chunk of people who are going to be hard to convince, and we're going to have to work on that. And engage with them, because we need a large majority of people vaccinated.
And at the same time that there's the public messaging, the science is progressing, as you noted, Dr. Curran. It seems like vaccines have been developed much faster than in previous epidemics. SARS, for instance, I think it took 20 months to even get to the testing stage, and by that point, it was the danger had passed. In this case, science is also bumping up against variants. I mean, how can you describe the challenge that vaccine developers and the public health community have in combating the different variants that have sprung up? For Dr. Curran is.
Well, I think this means adequate rapid monitoring. I think the available science would say that we can be preliminarily confident that all of the variants outside of the South Africa variant look like they're covered pretty well by the existing vaccines to which they've been tested. This process has got to be ongoing, and it's got to be ongoing also in the community. So the people who become infected after they're immunized, for example, need to be tested for the variants, and they need to be monitored. And the good thing about even the variants that may escape this is that the facility by which the vaccines were produced has already encouraged the companies that are producing them to start to develop newer vaccines or additional vaccines. So to some extent, they're chasing this already and monitoring it. It shouldn't slow us down in terms of the vaccines. This is one of the areas where it's very important to go with what you got and to innovate as you move forward. And I agree with Dr. Jha about a lot of the hesitancy is sort of a wait and see hesitancy rather than the ardent anti-vaccine hesitancy that we've seen with some of the vaccines in children that are promoted by the anti-vaccine movement. I'm also concerned that vaccine hesitancy will be used as an excuse not to provide access. We have access to information from trusted sources and access to vaccines. So if people say, for example, that minority communities are less likely to want to be vaccinated, that gives us an excuse not to provide trusted advisors out there with trusted information. So access to information is very important. And then also we have to keep it up, because as people see their partners and their friends getting vaccinated and being protected, that's a tremendous motivation. And right now we're still, the demand is still well below the supply. And that gives us kind of a national excuse not to deal with hesitancy. Right now, we're mostly talking about hesitancy rather than dealing with it. When supply exceeds demand, then we have to really act.
Yeah, as a matter of fact, according to the CDC, 151 million doses have been delivered in the US, as opposed to 115, 116 being administered. So Dr. Jha, if I could turn to you on this question, the science seems to be there, the policy is coming into shape, and now, as Dr. Curran's talking about, the demand, the access, we have the implementation. How do you rate the implementation of distributing the vaccines, of administering them in the US, and what can be done to improve it?
Yeah. So the implementation, the distribution started off pretty badly. I would say December and much of January was not very good. We've gotten better. We've built up a lot more vaccination sites, and we've added more community health centers and other places. And so right now we're administering about 2.5 million vaccine doses a day. Mm-hmm. And I think we have the capacity built up that we could get to 3 or 4 million a day without a problem. And if we can do that, that would be fantastic in terms of getting a good chunk of Americans vaccinated. But I want to go back to a point Dr. Curran raised, which I think is exceedingly important. We are confusing lack of access and lack of engagement, particularly in the African-American community, with hesitancy. And saying, I mean, just imagine, going into the to the African-American community and see you're somebody who's new, who's a stranger, there's no really good access to care, and showing up and saying, would you like a vaccine? That's not how this stuff works. You've got to engage with people who are trusted. You've got to work with providers who are there, community-based organizations. It's also not overnight work, meaning you don't just show up the day before and say to the community-based organization, hey, let's go get people vaccinated. So there's a lot of work to be done to do this well. And that work needs to begin now, because here we are in, kind of mid to later part of March, definitely demand outstrips supply. That's going to flip in about a month. Mid to late April, we will have more supply than demand. If we're lucky, it will be May, meaning there's plenty of demand. But if we're unlucky, it could be early April. We have a lot of work to get people ready, that third to half of Americans who may not be readily excited to get vaccinated. We have a lot of work to get the vaccines to them.
And one follow-up question to you on, as you mentioned in your testimony today in the House, that, and I didn't realize this, that variants make up more than half of the US infections. Which variants are or about that? Those
about
are
half. So it's the main one is B117. This is the variant originally found in Kent in the UK. We've just been tracking it. It keeps growing and growing and growing. And, it's somewhere around 45% today. And it'll be before end of March, it'll be 90% of all infections. And before end of March means, it's not that far away, right? And this is what is causing the plateauing of the cases in the US, with about a dozen states now actually starting to see increases in infections. I think it's all driven by B117. It's also driven a little bit by relaxation of public health measures. That's happening way too early, while still a lot of people unvaccinated. So yeah, it's B117. I have to say, this is the one I worry about. I mean, people talk a lot about the South African variant, the Brazilian variant. They both have concerning features, but I don't know that either of them will end up becoming major problems here in the United States. They might, but I'm largely hopeful they won't.
Right. And Dr. Curran, as Dr. Jha just said, that there's perhaps some premature opening. What are the benchmarks you're looking for before the economy opens more, before there's a lot more indoor activity? Is there a particular metric or series of metrics? What does success in that regard look like?
I think the major concern that a lot of us have is that the combination of COVID fatigue and political desires to open the economy and things like this will reduce the mitigation efforts before the vaccines and other types of immunity can really take hold. Now, we know we're not there yet. That perhaps 30% or more of Americans have already been infected with COVID and have some immunity, and 20% of Americans have some vaccine immunity. There's probably some overlap there, but we're still less than 50% of people that have really any immunity. But even with that much, you can see we were able to have 50,000 cases reported per day. You know, reported cases are just a small fraction of the total cases. So we've got a long way to go. And as we're vaccinating even 3 or 4 million people a day, it's not overnight. So the promise for the vaccine is a promise that's going to be in the future. We're going to get this promise, you know, fulfilled in the summer. It's not fulfilled now. It's not fill up the beaches and the bars in Florida, take away the masks in Texas. This needs to be, they need to go together. My daughter and other people who work at the CDC call it a Swiss cheese type of prevention mitigation efforts. And you can think of the vaccine as a pretty nice piece of almost no holes cheese, but it's only got 20% of the people. So you've got to have those other layers going, and they have to keep going until we're up to 70 or 80%. Otherwise, we're not going to knock this down as far as we want. And so we can't just say, well, let's relax mitigation and let the vaccine keep up so we can just keep it at a nice 50 to 100,000 a day. That isn't good enough. We're not going back to normal at 50 to 100,000 cases a day. So this depends on not just the people getting immunized, but the rates of infection going way down.
Right.
And that means that the vaccines need to be a real stimulus to people to keep up the mitigation efforts, not to stop them. Like, oh my goodness, there have been 113 million doses. Let's go party. No. There's been 113 million doses. When we get up to about 500 million, then we can think about a little bit of a party.
Right, and Dr. Jha, you've talked about this too, in terms of how to build more of a consensus on accepting on agreeing on a acceptable risk for the public. Do you see progress in that area? Do you have a way to help that conversation?
Yeah, this has been one of the most challenging parts of the whole pandemic. I've spent a lot of time with governors and health commissioners from various states, and every single time case numbers start declining, there is immediately this push to let's open up all the restaurants, let's open up the bars, let's do what we can to get back to normal. And there is a conversation that we have about how much infection are you willing to tolerate? How much death are you willing to tolerate? And the answer, if you look at how people are behaving, the answer is not zero. People are willing to tolerate a certain level of infection, hospitalizations, and deaths. Oops, I don't know. Did I just freeze there? Can you still see me okay?
Yep, you froze for a moment.
All right. So there's a level beyond which people really do pull back. So what I think what Dr. Curran said is exactly right from a public health point of view. The problem is even kind of more progressive governors are not interested in listening to it. They're just done. And so I am trying to find a way to say, okay, you can't do what Dr. Curran wants you to do, which I agree with. what can you do? What are you willing to do? And the framework that I have been using is to say, while I would like for you to wait until we get 70, 80% vaccinations, can you at least wait until all high-risk people have been vaccinated and have had a chance for their immune system to benefit from that vaccination? I mean, you have to wait a couple of weeks after the vaccination. And that gets us into kind of end of April into May before you start relaxing some of the public health measures. And what's very clear is that doesn't mean that at that point infections will go away. You'll still have a good chunk of people who are unvaccinated, not immune, and you'll still see some infections, but you should not see a lot of hospitalizations and deaths because people who are at high risk should be protected. And then of course we keep vaccinating and trying to get more and more people. So it's trying to walk a tightrope and trying to get people to hold off for another 4 to 6 weeks. It's a challenge because even here in Massachusetts, where I am, our governor has declared that we're going to have fully packed restaurants as of next week.
Right, and New York is going to allow spectators back at sports events. Same in California, and at least in New York, the rates are going back up.
Yeah.
So just to wrap up the U.S. side of this, Dr. Curran, what do you see as the biggest risk right now as the vaccines roll out to sort of keeping progress on track?
I think Dr. Jha is right about the wisdom of prioritizing the elderly for the first set of vaccines, and in particular, approaching nursing homes. The nursing home situation in the United States has been a horrible public embarrassment with 20, 30 or more % of the deaths coming out of nursing homes, which gives us an idea of how we treat the disabled elderly in our country. And by prioritizing that, we've seen the first effect of a decline in admissions from nursing homes to hospitals by prioritizing vaccine. Now, what we should see in the scenario that Dr. Jha has promised his governor is that we should start to see a big decline in hospital admissions. And instead of having 85% of people in the hospital over 65, like we used to see, we ought to see hospital admissions only among young people or young people under 65. Now, we're not going to see that exactly, but we haven't really approached a high enough proportion of the elderly until we see a really big drop in admissions among the elderly. And I think that is feasible, but that should be one marker we should look at if we're going to have that strategy.
Right. Okay. So now moving to the big wide world. Obviously, the news from Hong Kong is encouraging. It's a small territory. Taiwan is small. It's also got encouraging results. Israel is relatively small, and it's done a very good job of getting vaccinations out. So those seem to be bright spots. But French President Macron today just imposed lockdowns from tomorrow on a number of regions, and including Paris. The rates are going up all over Europe. So, Dr. Jha, what's the outlook for the broader world, and how does that affect the United States?
Yeah, this was the topic of the conversation at the House of Representatives Foreign Affairs Committee discussion for 3 hours. I'll give you my summary. Europe minus the UK. UK has got a very different trajectory right now, but the rest of Europe, or continental Europe, is looking like in some trouble, and it's it is almost surely because of B117, that variant that we discussed earlier, the UK variant, is really starting to take off, and we're starting to see big increases in cases. The sharp difference between Europe and the UK, or Europe and the United States, is vaccinations. The UK has vaccinated about 35% of its population with a single dose. The US, as you said, about 23%. And most of these other countries are well below that. It's 7 to 10%. And that means that they have a much more vulnerable population. And that's why they're getting into the trouble they are. And that's Europe, which has got more access to vaccines than many other countries. There is a broader global problem that around vaccine supply and distribution that I think we are underestimating how difficult it's going to be. And whenever you find a problem with a difficult set of solutions, it's tempting to reach for easy ones. And so I'm hearing a lot of kind of simple talk of, if we just made the vaccine manufacturers give up their intellectual property, all of a sudden that would magically lead to billions of more doses. This is just a hard problem to solve, and I'm happy to get more into it. I'd love to hear Dr. Curran's thoughts on some of this, but the global vaccination challenge is very substantial, but one that we have to rise to and meet. It is absolutely imperative that we get the world vaccinated, and not by 2024, as some estimates have said, but of course, I'd like to have a majority of the world vaccinated in 2021. It's not going to be easy, but I don't think it's impossible either.
Right. And so, Dr. Curran, the floor is yours on your thoughts about the initial global response.
I'd like to applaud Hong Kong and applaud Israel and for their work. They're both small countries. Hong Kong is more the size of Manhattan than the size of Israel. And it shows that even in a very population dense environment, which hasn't solved all of its political problems, you can have enough discipline and trust to get things done based upon science and protect the population from COVID. So I find it just amazing, as Professor Chan said, and what Israel's done has also been amazing. I won't want to say anything more about Europe except to agree with Dr. Jha, rather focus on the issue of the world. So one thing that COVID has shown us is that viruses are globalized, and they can't be kept out through any type of immigration status or anything else, that a virus can pop up and be around the world very, very quickly. And variants can pop up and be around the world very, very quickly. And usually we'll understand them better where there's science and money and resources. And that's true. That's what's happened in Asia. It's China and the wealthier countries in Asia. And it's also true in the developed nations. We still, to me, don't really understand what's going on in many of the countries that I was most worried about. I mean, I was thinking, oh my God, if this can happen this way in the United States, what's going to happen in Bangladesh? What's going to happen in some of the countries in Africa? And there's some very strange sero survey data coming out of India that makes you think that the transmission of the infection must be much worse than the morbidity, or the data's not right. But I think we don't really know exactly what's going on in the rest of the world like we do in the country. So I'm worried about that. And I think that it's true that we're not safe completely anywhere unless we're safe everywhere. There are a lot of models for global vaccination. It doesn't happen overnight. I mean, we're not going to vaccinate the world by the summer. And we have to keep an eye on this virus and other viruses going into the future. But we need to have a global international commitment to getting it done. And the vaccines have to be cheap, but that's only one small part of it. They have to be available. They have to be delivered. You know, they're going to have issues of trust and concerns also in their populations. And many of the populations simply do not have the resources. Now, one thing going for international vaccine distribution, and we saw this a little bit with the Ebola outbreaks in Nigeria, is that the international vaccine networks that have been put together by the WHO over decades for childhood immunization, that have brought childhood immunization rates up pretty high, have some talented infrastructure and talented people to help deliver vaccines in even the poorest countries. Vaccinating adults is always different. Mm-hmm. And getting this done in developing countries in a widespread way is different. But we have to get to know more about what's going on in those countries, really. And it points out the need for much better global surveillance and coordinated surveillance throughout the world. Public health is always political. It should, in a pandemic, never be partisan or nationalistic. And of course, that's idealistic, but idealism is the half brother of optimism.
Well, it shouldn't be nationalistic, but it is playing out in kind of a great game scenario with the various donations of vaccines from China and Russia. And today, the Biden administration announced that it would be sending 2.5 million doses to Canada, or to Mexico, 1.5 million to Canada. Dr. Jha, what can be done? I mean, first of all, are the diplomatic efforts meaningful in terms of actually resolving this problem and getting enough people vaccinated? And how can the US sort of step up its role in whatever global architecture is built for the COVID effort?
Yeah, great question. So there is a global architecture for getting vaccines out. We heard from Professor Sophia Chan actually about this, and that's the COVAX facility. And I think America has already committed under the Biden administration in playing a role, and I think that's a good thing, and they should do more of that. In my mind, there are two sets of opportunities for the United States to have a leadership role. One is certainly by May, certainly by June or July, but even by May, we will have an excess of vaccines. We're going to have plenty of vaccines. We've got 30 million doses of AstraZeneca sitting around. That's the 4 million that we're giving away. That still leaves us with plenty then, and we can make more. And we should make more. And we should give it away. And we should give it away. We should probably give some chunk of it to COVAX, and then some chunk to countries where there may be hotspots or real need where the vaccine would do a lot of good. So in my mind, that's one part of America's strategy, is keep making vaccines and giving them away, because we have enough now kind of bought and going to be delivered to vaccinate every American 3 or 4 times over. We don't need that. Second is we need a global effort to ramp up vaccine production. And this is much, much harder than it looks. You have to find facilities that can actually produce vaccines. The one key point that I want people to walk away with is vaccines are not like pharmaceuticals. You can't just, these are biologic agents, and they need a lot of very careful work in order to make them reliably and safely. And it's going to be critical that we engage in that. So there's a real opportunity for US leadership to ramp up vaccine production, but that's going to take a lot of work in finding raw materials, finding people who can actually build vaccines, people who have the technical know-how, a lot of complexity, not unsolvable, but it's not going to happen on its own. COVAX isn't going to be able to do it. WHO won't be able to do it. Will require national leadership from President Biden or another global leader.
Thank you. We're almost out of time, but I want to extend it a little longer to get to some of the audience questions. So I hope that's okay with our speakers on the East Coast. It's getting late. Asia Society audiences are typically global travelers. And so we have a question about that, and it's for either one of you. Do you think that showing proof of vaccination will become mandatory and the norm for future travel? Can you think of any reason for exceptions to this if it were implemented?
I'm happy to start. I can imagine, we've already heard from some CEOs of major airlines that for long haul flights, they are going to implement some sort of a vaccination requirement. And, I actually think about the fact that I probably used to go to Hong Kong twice a year until obviously the pandemic. And it's a 16-hour flight from Boston to Hong Kong. It's a direct flight. And I would feel much, much better spending 16 hours with, a couple hundred people that I don't know if I know everybody's been vaccinated. So building confidence back in global travel, I think will require it. And I do imagine that a lot of airlines will ask for it. Obviously harder to do when large chunks of the world isn't vaccinated and can't get access to vaccines. So do you require it? And what do you do with travelers who are in countries where vaccines are not readily available? So there are going to be some challenges, and there may be a transition period, but I can imagine vaccinations could end up being a pretty important part of global travel.
I think that it falls in the general category of, will vaccines be mandated for X, Y, and Z? Will it be mandated to work in a hospital? Will it be mandated to attend a university? Will international students need to be vaccinated to come to the U.S.? Will students come to the U.S. if they find out that it isn't mandated for other students? Will parents let their kids live in residence halls if people aren't vaccinated? We aren't even quite wrestling with this enough from my point of view, in part because of this supply and demand issue, and also the vaccines are still available under emergency use authorization. So until they're really licensed,
Right.
it's hard to really mandate them. But I think there's going to be a lot of pressure for people to be vaccinated under a variety of conditions, including travel. And there'll also be a lot of incentives for people. Many universities, including ours now, will be requiring people to be tested every week. And of course, all the sports organizations, people get tested every week. I can see that if you have been vaccinated and can prove it, the frequency of testing may go down. Now, that doesn't mean it's mandatory exactly, but it does mean that, you know, you have your choice between getting vaccinated or getting a nasal swab once a week for a long time. And I don't know how it's going to play out. The problem with mandates is that they're discriminatory, just like prioritization is discriminatory. And when you start to discriminate, you have to ask yourself whether it's honest discrimination or not. You know, are you saying only, when you say only certain groups of people can do something, and then you look at the groups who are disqualified, you find that there are often disparities there by race, age, educational status, access to vaccines, insurance status, a lot of things like this. So I think it's important for people to start to wrestle with this issue now, both the positive incentives for vaccine and then the negative incentives for not being vaccinated. But like Dr. Shah says, there's some inevitability to this. The other thing is entry into countries. Right. I'm not sure Hong Kong is going to want Americans to come visit too often unless they've been vaccinated. They don't have any cases. They don't want to introduce it into a city with 7.5 million people in a very small place where spread could happen very quickly.
Thank you. And last question, and each of you can give a quick answer to this. And it gets to the issue of global collaboration and possibly overcoming some of the nationalist feelings and collaborating on a scientific level that may or may not have happened in the past. The question is there an effort to buy and run trials of the Russian vaccine in the West so that there can be another sort of Western approved candidate if it's shown to be effective? That goes for the Chinese vaccine as well. I mean, has this been done before? Is it worth a shot?
Yeah, it's a good question. So a lot of countries in Africa are starting to now use the Russian vaccine. The Russian vaccine has not gone through any kind of regulatory approval, well, outside of Russia, at least that I'm aware of. The EMA, the European Medicine Agency, has said they will evaluate it on kind of a rolling basis. I'm not sure exactly what that means. But it is absolutely essential in my mind that the vaccine be evaluated much the way that the BioNTech Pfizer vaccine, Moderna, J&J, AstraZeneca have all been. That's going to be a really critical part of this. I don't know that we need to run another trial. We might. But what I do know is that the data that underlies the reporting has not been made public in a way that would need to be made in order for these things. But maybe just my last point, there is now going to be a flood of vaccines. And one of the best ways of creating hesitancy, in my mind, is not going through a careful regulatory process on each of them to ensure that all the vaccines that get out there are safe and effective. That's probably our best long-term game plan for helping people feel comfortable about these vaccines. And I'm deeply worried that a lot of vaccines are getting out there without that regulatory evaluation.
That's an excellent point. Dr. Curran, would you like to?
The only thing I would add is that the days of the randomized controlled trial with placebo recipients are close to being over in the United States, except for children. I was actually a vaccine trial participant myself in the Moderna trial. And the idea that people would go in when you know you can be immunized with a safe vaccine and volunteer when you might get a placebo will be considered unethical in many areas and won't be allowed. So there have to be ways to evaluate vaccines, to evaluate the existing data that haven't been shared, but also different types of study designs to look at equivalency rather than to look at placebo-controlled trials.
Right.
And moving to countries where there's no vaccines to doing those trials will also be thought of as globally unethical, I think.
Right. Well, I'd like to thank you both. This has been excellent, and I've learned a lot. We appreciate your time and your expertise. And so I'm going to end with my four-letter story. You both were superb. And there's a three-word epilogue. This story continues. So with that, thank you. And I'm going to hand it over to Hong Kong, Alice Mong.
Thank you, Jonathan. Thank you, Dr. Jha, and thank you, Dr. Curran and Dr. Sophia Chan. I am really delighted to be here. And as I said before, just got my first vaccine yesterday, and I am looking forward to traveling when I can get back to the States to see my family. And I want to again thank our wonderful speakers and Dr. Chen, who is we actually interviewed her yesterday, and we have an extended a program that we will put on Asia Society Hong Kong website for those of you who are interested. She goes into more details about what's happening here in Hong Kong and some of the plans. So please check out our website. And I want to thank Dr. Jha. It's great seeing you again. And even though it's in Zoom again, last time we saw you, it was episode 18 in July. And I really thought when we started the series on our COVID update, it would be a short term, maybe a 6-month project. Little did I know that a year later, we are here on episode 28, as Wani has mentioned earlier. And but I know one of the key thing is really to get to know from the experts. And one of the things that Dr. Curran addressed is really about the uncertainty. If we can help address the uncertainties, that certainly is a public service. So I want to thank Dr. Curran for being here, and we look forward to welcoming you to Hong Kong in person in the near future.
Been there. It's a great place.
I know. I will. Well, we look forward to walking to Asia Society Hong Kong for a program like we had with Dr. Jha when he spoke about Ebola a few years ago. So we look forward to traveling again. So thank you to our wonderful speaker and the staff. It's been a delight for Asia Society Hong Kong to collaborate with our Asia Society Southern Cal colleagues. It's been, this is one thing that I think a positive side of COVID has brought the Asia Society family closer together in terms of our program planning. So it's programs like this that we are able to bring you globally. So I really want to thank Lee, Angeli, and Charlie, and my staff here in Hong Kong for making this program this morning possible. And look, and if you like what you're seeing, please support us by becoming a member of Asia Society Hong Kong or Asia Society Southern Cal. We really need your support. All the programs we've brought to you this year, it's been mostly free online. So please join us in supporting Asia Society Hong Kong, the global family, if you like. And I want to also kind of end on talking about the upcoming programs. I think we right now, I know you can see some of the program that's coming up on your screen that LA will be doing. And here in Hong Kong, episode 29 will be coming up in a few weeks for first part of April. A conversation with Professor Manfred Green talking about the Israel experience. Israel has already kind of vaccinated over 50% of the people. So a lot of lessons to be learned from Israel. So join us in April when we have an opportunity to talk to Professor Green. And on that note, I want to again thank all of you for joining us this morning here in Hong Kong, afternoon and evening in the US, and really stay safe. And thank all of you for being part of the Asia Society global family. Good morning and good night. Thank you.